Hello and welcome to Vanguard Live. My name is Damiola Ogushaki, and this is lunchtime discourse. And of course, this is another edition, and here we'll give you beautiful details. And of course, we have interesting girls with us usually on this show. And of course, today we'll be discussing COVID-19, increase in COVID-19 in Lagos, especially in Nigeria. And of course, recently, PTF, according to reports, PTF said that the increasing cases of COVID-19 in Lagos is actually more than what NCDC can bear. And looking at this is really raising panic in Nigerians. And that is why we are going to be talking more on this today. And joining us on this show is Dr. Oluwajimi Sodipo. He is the chairman of the Medical Guild in Nigeria. You're welcome, Dr. Sodipo. You're welcome.
Thank you very much. Thank you for having me.
Okay. Of course, COVID-19 started from Lagos in Nigeria. And how will you assess, the increase of COVID-19 in Lagos and how it has impacted Lagos?
Well, thank you. Well, we know that since the advent of, or since the entry of COVID-19 into Nigeria, Lagos State has been the epicenter of the pandemic as regards to Nigeria. And I think currently we have more than 70% of cases of COVID-19 in the country, which is a large burden on the state. Initially with the response, we all know about how the response started with the index patients being the Italian citizen, and subsequently, despite all attempts, we've seen number be ascribed to that include facts that some of the reasons that we ascribe to the increase, are multifactorial. We need to mention that when COVID-19 started in Nigeria, we had a little bit of an advantage because COVID-19 had been taking part in occurring in other parts of the world, and the aim was for us to replicate what some of those countries had done, so that we'll be able to get things under control before they got out of hand. The initial response was based on that most of the people with the virus, which at that time were imported from other parts of the world, were going to be isolated or quarantined, and subsequently you prevented it from getting into the community. Unfortunately, that response failed, and now we're at the level where we have widespread community spread, which is attendant effects. We know there was a lockdown. Unfortunately, when the lockdown occurred, a lot of what should have been done during the lockdown wasn't achieved. For example, then we're supposed to have very aggressive testing and isolation of cases or quarantine of suspects. By then, we're supposed to have gotten our testing capacity to the maximum, so that you'll be able to contain everybody that had the virus and prevent them from spreading it in the community. Unfortunately, that wasn't also achieved. So the level that we are in now is we are seeing, because of the fact that COVID-19 is both a health-related problem and an economic-related problem and a social problem, we are now facing both the combination of these three problems at the same time. The hope was that if we had focused on the health-related challenges, we wouldn't be able to, we wouldn't have so much of the economic and so much of the social problems. Unfortunately, we couldn't tackle that. So we are now at the level where we are facing the health-related challenges. And for us as medical practitioners, it's really a little bit of a challenge.
Okay.
Because we have widespread community spread, what we are seeing is that one, we have a lot of health workers being affected by COVID-19. Number two, we're also seeing situations where the mobility, that is number of cases in the community, is increasing.
Okay, let me bring you back. You said the response in Lagos. How will you actually rate it? Do you think Lagos State really did well when it comes to that response?
Well, the government did the best that they could at that time. However, our challenge had been that In such a response, what we needed was a multi-stakeholder response. We know that there was a lot of, when the response started, there was the Emergency Operations Center, and we know that a lot of advice was gotten from multinationals, a lot of advice was gotten from other individuals, but our own major concern was that, for example, the medical guild, where we are stakeholders, we needed to involve all the stakeholders in this. We needed to also involve aggressively the community. We needed to also ensure that the major aim, because that was what happened when the lockdown started, there was an aim for the lockdown, and that aim of the lockdown was, as I explained, get your testing up to maximum capacity. Try to test everybody that is a potential suspect, because then we're dealing with a limited number of people.
Okay. Okay, well, sorry, it seems we're having a network issue from its side. Let's go on a short break and
Sorry.
Okay, I think we have it back.
Oh, sorry, there was a break in transmission.
Okay.
So as I said, all that wasn't achieved. So, I mean, if we were to rate it, we'll give it, at least I would personally give it maybe a 6 over 10, because of course we're dealing with the novel virus. But we felt that getting more stakeholders involved would have probably helped the situation better.
Okay, so given this rate that you talked about now, it's actually some time now that we've been looking at this. So what can you say now is the cause of this major gap, and why are we still having decreasing numbers of coronavirus cases in Lagos?
Well, as I explained, because of the fact that we are now having the economic and the social problems of COVID, what has happened is people, the citizens of the state, of course, we know that people have a lot of economic issues, so because of that, there's been a relaxation of the lockdown. Because there's a relaxation of the lockdown, what we are seeing is that we're having more contact amongst people. And of course, we know that there are supposed to be guidelines that are supposed to be followed when we are trying to have this interaction with people. For example, there should be social distancing. For example, there should be use of face masks. For example, there should be issues like use of hand sanitizers and things like that. That has all failed. I mean, you only need to just take a stroll on the streets during the day, and you see that we're probably having less than 20 to 30% of people using face masks. And that is on the issue of social distancing, that is even null and void as we speak. And of course, on the issue of things like hand washing and hand sanitizers, again, that has been a failed situation. Again, it's because a lot of people don't really understand the impact of COVID. Because sometime during the response, the kind of picture that people were seeing for COVID in Nigeria, where people, looking very healthy, people smiling, people going up, even some people dancing, to the average person, that played into their mind that, despite what we are seeing from Europe, despite the people that are on ventilators, despite the people that are dying, it seems as if in Nigeria maybe we have some level of immunity. And there was that theory that, there's this immunity, maybe because we are in Africa, maybe because you are under the sun, you can't have COVID, and even if you have it, it's just like as if you're having malaria, so there's nothing for you to be worried about. But of course, all those fed into an unfortunate narrative, and that is why we're having this situation now where we're having increased spread, and of course with increased spread, we're also having increased number of deaths, especially among the most vulnerable.
Dr. Shedipo, are we close to the peak of the epidemic?
Well, the truth of the matter is that we can't say where we are on the epidemic. The only way for you to be able to assess where you are on this epidemic is by constant maximal testing. Now, what happens in all parts of the world where they get to the epidemic, to the peak of the epidemic, is that you have a situation where there is maximal testing, and when you have maximal testing, you now get to the maximal number or the maximum number of cases and maximum number of deaths. And then you now get to the level where once you discover that from the maximum numbers that you have, you are now getting a decrease, you now assess that you've gotten to your peak. Unfortunately, we have some stop gaps, some starts and stops in terms of testing. So there's some times that we were testing very aggressively. There were some times that we ran out of things like reagents and things like testing materials. So that didn't allow for maximal testing. So for me, I think that we are still trying to approach the peak because every day you see new numbers and these new numbers are increasing. So until we can sustain this for a period of time, probably maybe a month, and you see that you have now gotten to the maximum numbers. I mean, for example, daily we get cases of like 600, 700 sometimes. So by the time we now get to that maximum number, we see that we're not getting beyond that, despite the fact that we are testing at the maximum level, and you now start seeing a gradual decrease in number of cases. Maybe from your 700, you're now seeing 500, you're seeing your 400, you're seeing your 200, despite the fact that you're testing people. That is when you will know you have gotten to the peak and you are now coming down. But as of this moment, nobody can actually categorically say that we've gotten to the peak. I think we are still rising to the peak, at least from the professional point of view, from the medical.
Okay. A few days ago, the medical guild posted on its Twitter account that despite being the epicenter, Lagos State government has not deemed it fit to pay attention to the health workers, especially the doctors. So can you throw more light on these and tell us exactly what the problem is?
Well, thank you. Well, first and foremost, let me just define what the medical guild is so that everybody, is on the same page with us. The medical guilds are doctors that are employed, an association comprising of doctors that are employed by the Lagos State government. And by virtue of that, we have doctors at both the tertiary, secondary, and primary level. And we've also been involved in the response as per COVID. Now, our first browse was that we feel that in this response, we need all stakeholders on board. And initially, when the response started, we all know that there's what is known as the Emergency Operations Center. Initially, the medical guild was part of that Emergency Operations Center and trying to give suggestions on the way forward and solutions that would help in this response. But unfortunately, as I speak to you, we're no longer part of the response, and somehow we were chopped out of that. And that actually now led to some of the problems that are now coming up, because if we had been part of that, we would have raised some of them at that level and probably not become a problem. Of course, we know that there are challenges with health worker testing. From the little data that we have from people that are tested, we've seen that we're having increasing number of health worker infections. We're also having we've had a couple of health worker deaths, and of course we have other complications amongst health workers. And our own strategy was that we need to prioritize health worker testing for two reasons. Not because health workers are special. Every human life is very, very important. But number one, you want your health workers to have the boost in morale that they're ready to face COVID head on. So you don't want a situation where people are exposed, they feel that they're ill, they need to get tested, and that is not done for them. Of course, that leads to a lot of moral issues. The second problem was that we felt that there should be a prioritization of that testing and result notification, not just for health workers, but also for people that are in the hospital, that is, those that are very ill, because they are the most vulnerable, they are the ones that are likely to die. So we felt that if we had a system in place where we could prioritize, yes, everybody wants to get tested, but we need to be able to see if we have 10 people that need to be tested and we only have 5 kits, Mr. A and Mr. B need to be tested amongst those 5 kits that we have because of that importance. And we try to prioritize healthcare workers and also prioritize the patients. Unfortunately, that is not the situation as I speak to you. Another challenge that we have with the response has to do with personal protective equipment. Yes, we're all aware that, of course, when the response started, challenges with personal protective equipment were there. And at a point, the price of these things skyrocketed. Part of our own suggestion was that government may have actually needed to stockpile some of these things and even continue stockpiling, because it's not, COVID is not going to go away in 1 day or in 2 days. So you need to have that constant supply of personal protective equipment, and not just having a supply, but having a clear-cut guideline on its use, where every hospital, people are using the same, level of protection, and that gives a boost across the line that yes, we are using these things and we are being protected, and there's less likelihood of being affected. Of course, we have some challenges to that, and those challenges are ongoing. And we also have our colleagues that are working at the isolation centers. Of course, I need to commend Mr. Governor of Lagos State. He took the lead in terms of Lagos State being the epicenter, and of course, they started taking care of our colleagues that are working at that those isolation centers. But the challenge that always come about is some of them having challenges with their welfare. Some of them having, there was no open communication on, based on the risks they are going to get, things like their insurance, and made clear to them so that they can just face what is most important to them, which is their work. And so that I don't go on and on, we also had a problem with shortage of doctors. Of course, you know that before COVID started, we already had a shortage of doctors, we already had people emigrating, both outside the states and outside the country. Of course, with COVID, what happened was that could no longer continue because there's been a ban on air travel. And already we already had a depletion. Now, unfortunately, we're approaching a time when the air travel is going to be lifted very soon, and we already feel that a large chunk of people are already also on their way out. And even for those that are left, we already have a drastic shortfall in the numbers of personnel. When you now combine that with the fact that some people are ill, when you combine that with the fact that a lot of our colleagues have also volunteered at the isolation centers, that will give you a picture of the critical shortage that we are facing. And of course, the last issue had to do with when this whole response started, the federal government called the healthcare workers, and I would say healthcare workers, not just doctors, discussed with them, said, okay, we know that you're going to be experiencing increased hazard, but we need you to be at the front line. We need you to keep on going on. We need you to face this COVID with all seriousness that it deserves. So what they did was that they talked about things like hazard allowance. They talked about things like their life insurance.
Okay.
Because I explained to you, anybody could lose their life during the course of the battle. So unfortunately, for those of us in Lagos, we've been trying to communicate with the government that please, can we have this discussion? We're not oblivious of the economic issues that are going with COVID. And we are not saying that we must get this or must get that. What we're just saying is that can we start a discussion where people can start understanding some of the challenges and we all work together to be able to solve some of those challenges. So in a nutshell, we've had three major problems. One that had to do with the COVID response, as I explained, from the EOC, from the fact of healthcare worker testing, from the fact that our colleagues in the isolation centers have challenges and the PPEs. And of course, the second one has to do with shortage of doctors, and the third one has to do with the fact that there was a federal government negotiated agreement with federal healthcare workers, many of whom are not even at the epicenter of COVID. We've not had any discussion in Lagos. We're just hoping and begging that we will have this discussion and push the morale down the line so that people can continue doing the fantastic work that they're doing.
Okay, Dr. Shodimi. Okay, viewers, if you're just joining us, this is a lunchtime discourse on Vanguard Live, and I've been discussing with Dr. Oluwajibi Shodipo, who is the chairman of the Medical Guild, and he has been discussing about the increase of COVID-19 cases in Lagos. Now, back to you, Dr. Shojimi. Dr. Shodipo, rather. You said that like there have been increase in the cases, and also talking about the doctors who have tested positive. Can you tell us like how many doctors have tested positive, and why the doctors are finding it very difficult, to get tested?
Well, for the issue of the number of doctors and other healthcare workers, I can't give you a specific figure because even as I speak to you, I'm sure the number is increasing. What we have ascertained is that a number of our colleagues are affected. Of course, we don't want to cut dramatic headlines and probably lead to challenges with people having complex health sector by giving numbers, but I can tell you that it is a number. And we have emphasized, and because of that number that we have emphasized, that we want to get tested, so that because the doctor and other healthcare workers play a critical role in care, we want to avoid nosocomial spread, which is spread from colleagues to colleagues, or spread from colleagues to the hospitals, or colleagues to even patients. That's why we have emphasized on the fact that we want to get tested. Now, the current situation is that the only institution that have given us some level of leverage or some priority was the Nigerian Institute of Medical Research, NIMA, at Yaba. What they've done is that they created 2 days where healthcare workers could come in and get tested, and of course you get your results notified on time, so that if you need to be treated, fine. If you don't need to be treated, you can go back to work with confidence that you're free of the virus, and you can go about, of course, still maintaining infection control mechanisms, but also being able to carry out your job. Now, our own suggestion, because I'm not just coming out with problems, have been that even at the other points where people are being tested, for example, at the mainland hospital where you have the Lagos Biobank lab, can we be giving some priority in terms of maybe a specific day or some days or some specific time of the day where healthcare workers are? And when I say healthcare workers, I want to emphasize it's not about doctors alone. We're working as a team. I'm talking about doctors, I'm talking about nurses, I'm talking about down the line, everybody, the pharmacists, anybody that has been exposed and feels that they need to get tested or is symptomatic, to get tested and they get their results on time. We also try to prioritize the fact that in hospitals, where you have a situation where somebody calls in and says, okay, I have a suspected COVID case, and that person needs to be tested, that person is tested with priority and results are gotten. Why we haven't gotten to that level, I don't know. But it goes back to one of the statements that I made, which is that if we are involved in the process of decision making, it is easier for us to make these suggestions where those decisions are being taken, and of course it's implemented. What we are doing now is that we are on the outside, so what it seems as if one is complaining. And we said what we are trying to do is not to complain, it's not to try to create panic, is to try to provide solutions so that we get the pandemic sorted out as soon as possible.
Okay, now according to reports, there's been reports going on that when doctors test positive for coronavirus, they are abandoned in their homes or in isolation centers. Can you explain more of this to us?
Well, first I will need to commend the government for one initiative, which was a suggestion that we made to the government, and the government actually implemented that, which was the creation of an isolation center for healthcare workers. I wouldn't just want to come here and criticize the government, or we need to commend the government in areas that have actually listened to advice and taken those solutions. Of course, again, because of increasing numbers, we know that, because of increasing numbers, we know that some people have not been accommodated at that isolation center. And secondly, I think, which is where we have also tried to cry out, is the fact that we need those tests to be done on time and results gotten also on time. The challenge we've had a couple of times is that people have actually been at home, they've done the test, maybe after going through the whole rigors as every other person, and then they get notified of the result late. Of course, that has caused some problem because the person has been at home or has been at work and has been exposed to more people, and so the dimension now increases. What we have done as an association is that we've seen ourselves as stakeholders in this process, and we try to reach out to any of our colleagues, also working alongside the Nigerian Medical Association, that anybody that gets tested, that is positive, and that needs any form of solution, we've actually had to step in the gap to provide that while interfacing with government. But the whole aim of our discussion is that if we are involved at the point of decision making, it will be easier for us to be able to solve some of these problems, because we will be able to give government these statistics on time and ensure that nobody has to remain at home if they are ill. Everybody that needs to be in an isolation center or needs to be treated is there. And even if we get to the level where it's decided that, okay, for whatever reason you want to use the principle of home-based care, you actually have a stratification to be able to monitor those people so that you prevent any form of complication. Again, it goes back to the first thing I've said, involving stakeholders in decision-making process, for example, the medical guild.
Okay, Dr. Shodipo, according to reports and some discussions, it has been said that doctors are asking and saying that they want to go on strike. And looking at the continuous increase of COVID-19 cases in Nigeria, should it be now that the doctors should be putting their demands first?
Okay, thank you for that. In fact, I get bombarded with that every time. Even I myself, as a doctor, I know what it means to go on strike. First and foremost, I would like to make it clear that nobody likes going on strike. Nobody wants to go on strike. That is the first thing that I think every member of the public, everybody has to know. Sometimes strike is seen as an option to draw attention to problems. So a lot of times when notices of strike are given, it's not because people want to go on strike, but so that attention can be diverted from other issues to face some of the underlying problems that would precipitate the strike. Now, I'll now go on to the medical guild. For example, the medical guild has given a 3-week strike notice to the Lagos State government, which is supposed to commence on the 26th of June 2020. Of course, we are going to have a meeting before that so that if there's progress, that can be shelved. Before this, we've been trying to highlight a number of issues, some of which are still highlighted here. And if you look at some of them, I'm sure even as a journalist, you will see that some of them could be resolved through dialogue without anybody having to actually down it. But we need people to make that move and to reach out. Unfortunately,
but sorry to cut you off. Should that move be now when the cases, we're having increased cases of COVID-19 in Nigeria?
Yes, let me get back to that. Now, we had an increased number of cases without a strike. I think we can all admit to that. And And the aim is that what we should look at is by what people are asking for. One, will it prevent a further increase in the number of cases and deaths? Number two, can we have a situation where what is being asked to prevent the strike can be provided intelligently without having to go? A strike does not mean that you must go to on a strike. A strike notice is simply a call to attention that can we resolve issues so that they don't lead to a strike. There is never a good time to go on strike, whether it's COVID-19 or it's not COVID-19. As a healthcare worker, you know that you're dealing with people, you know you're dealing with lives. You know what is going on. And that is why amongst, even though when the federal went on strike, we exercise restraint. We are the epicenter of this. We've not even made a move. What we've been trying to do is collaborate. What we've been trying to do is become stakeholders. I gave you an example that we were probably initially part of the emergency operations center. Suddenly we were no longer part of the emergency operations center. How do you make your complaint? How are those complaints sorted out? So I want everybody to realize that there's never a good time to go on strike. Nobody wants to go on strike. Between now and the day that strike action has been called, a lot can still be achieved. In fact, because of the fact that there's a need to achieve so much more, unlike in the past where people just say we're going on strike on so day and we're going on a total strike, what has even been made is that there will actually be a body strike. What has even been said is we're going to have a meeting even up to the evening before that strike, so that discussion. So what we need right now are the media houses and others to play their role, reach out, start asking these questions. Can you call these people? Can they discuss? Why must you allow them to get to the point where it's a desperate call for help before people now say they are going on strike? I just give an example of shortage. Yes, the solutions can be made to that. Why would somebody go on strike? I've just talked to you about healthcare worker testing. Is it not important? We have talked to you about patient prioritization in testing. Should that be left unsaid? I've talked to you about emergency operations center and getting the medical guild and others involved so that they are stakeholders. They can make suggestions. Won't that improve the COVID response? I've talked to you about an MOU with the federal government that talks about life insurance. Should people not talk about their life insurance? A lot of people that are involved, for example, if you have a 40-year-old healthcare worker that dies, or a 50-year-old healthcare worker that dies, who cares for the family? These are questions. So nobody wants to go on strike. I need to make that clear here. Everybody is reaching out, calling, sending messages, complaining openly so that issues can be. If I would have even complained much earlier. You asked me about the number of doctors affected. If I were to give a number here, they probably want to shut down the studio. But the point is, we're not here to create panic. What we are here to do is, how can we solve problems? So we're not here to just brandish numbers, brandish threats. We just want this. We should look at this as a call for help, an appeal for help, an appeal for intervention so that we don't have that strike. I think that's just the best way I can put it.
Okay, Commissioner of Health, that's Professor Akin Abayomi. He has always said that the state prioritizes PPEs in the hospitals, and the Guild has also complained that that PPEs are not enough to prevent the spread of the infections among the doctors. So, what's your response to these statements by the Commissioner of Health?
Well, we've had interaction with the Honorable Commissioner of Health, and it's a constant interaction. Again, that was why I wanted to be part of the EOC so that some of these issues could be sorted out in terms of an analysis of needs, an analysis of people's ideas, because you could have a situation where everybody has different ideas on the type of people they need. It's just like a soldier that is going to war. You may feel that by giving him a machine gun is okay. He may want something else because we're dealing with life and death issues here. And just until recently, I know a committee was set up, and that committee was supposed to interface on trying to solve some of these problems. We're not saying there's a total lack of PPE. What we are saying is that we must have a uniform agreement. One, because the problem with COVID is that, for example, if you are protected, let's say I'm working with you, and we're both in the same team, if you are protected and I'm not fully protected, we could have a problem. Even if you are protected and you feel that you are not protected, you could also have a problem because you don't have to ability to work. So what we have said is, sometimes it is a constant need. As I speak to you, it is an evolving situation. For example, you've said it yourself, there's an increasing number of cases. That obviously means to the fact that you're going to have an increased need for personal protective equipment. We know that it's not all about personal protective equipment. Even we as Vanguard have reached out to our members. We've done things like infection control training, so that people know that don't have a coffee beside me, there's no need to worry. No, what we are saying is this conversation has to be continuous. As I speak to you, the amount of people you are going to meet yesterday is going to change tomorrow, it's going to change next week. We need to all work together to be able to come up with an analysis that will benefit everybody. So yes, I agree that some PP has been provided. I agree that we've had discussions with the Honorable Commissioner of Health, with the Ministry of Health. What we have said is that we need constant, this thing has to be constant dialogue. It has to be constant education. It has to be constant provision. It has to be constant analysis because the situation is fluid and keeps changing.
Okay, if you're just joining, of course, this is still a lunchtime discourse on Vanguard Live, and I'm Damlola Ogunshaki. I've had Dr. Oluwajimi Shodipo. He joined us via Zoom from Lagos State, and of course, he has been discussing, the increased number of COVID-19 cases in Nigeria, especially in Lagos. Now, Dr. Shodipo, talking about these increasing number of COVID-19 cases in Nigeria, Lagosians have actually been accused of breaching the safety guidelines set by the Presidential Task Force, that's the PTF. The state government has also been accused of not enforcing compliance. So, what advice does the Guild have for this government and also for the people?
Thank you. Well, ever since lockdown, unfortunately, we've seen a situation where, as I said, some people have a wrong impression about COVID, and because of that, they've thrown caution to the wind. We must see COVID as a public health emergency, and when you have a public health emergency, all steps must be taken to protect every single member of the public. The first challenge we have seen is that there is no adherence to these guidelines. Simple things. Stay 2 meters away from somebody. Use face masks. When you are going and interacting with people, especially a large number of people, use a lot of hand washing. Report when you are ill and take steps like that. Unfortunately, those are not being implemented by the populace, and there's nobody that is there to enforce it. And this enforcement can be done through various means. First thing is to allow people to understand the reason why they have to do it. The average Nigerian just thinks that somebody is forcing me to wear a face mask. Somebody is forcing me not to see my relatives. Somebody is forcing me to wash my hands. Not even seeing the benefits that they have to them. I know the government has done some level of health education, but sometimes too, in trying to allay the fears of people, some people got it wrong. For example, when people saw people dancing happy, at isolation centers, they just assume that, if this is what it even means to be sick with COVID, then why am I stopping myself? Why can't I throw all caution to the wind? We need people to realize that a lot of people fall very ill. And even apart from getting better, some people even have complications. So the first thing is, lots of health education has to be done. Secondly is that we need to try and enforce some of these measures. And of course, you know that we are dealing with a large population. You can't go around arresting everybody. You can't go around taking drastic measures like this. But things as simple as fines can come in. I have been to a number of businesses where I walk in, I'm using my face mask. Nobody there is using a face mask. Why they are laughing at you and saying, who is this person that is using a face mask? Maybe he has some problems. You understand? So the point is, even the government can go around. We could talk to our business owners. Yes, this will allow us to even ease the lockdown faster. But allow us to get on top of the situation faster. It will reduce the period that people cannot engage in their normal economic activities. You only need to see what happened in New Zealand. You only need to see what happened in places like South Korea to see the fact that because people really took urgent measures quickly, they had a shorter period of lockdown and they are out of lockdown. Again, when they saw a spike in cases, they reassessed the situation and they put in other safeguards as necessary. So things as simple as fines could actually help by going to businesses and letting them know. Things as simple as really showing the true picture of what is going on in terms of how people are ill. We let people know that this is not a joke. Even the statistics, we've talked about the fact that we also need to get on top of our statistics, especially things like number of deaths. We need to really be sure of how many people are really dying from COVID. Yes, we know how many people test positive on COVID because that is a test. But some people, unfortunately, do not even get to the hospital before they die. We never knew. So we need to keep on evolving our ways. How do we even report the number of cases that have died? Because those are the kind of things that can make people change their attitude. I was happy when Mr. Governor stopped the planned reopening of religious houses because that was based on data. That was based on the fact that we had an increased number of cases. That was based on the fact that they were seeing the trend of an increased number of deaths. That was based on the fact that people were not adhering to the simple laid down procedures. And that's what I tell people. If people had been adhering to the simple laid down procedures, of course they would have released the lockdown, or they would have eased the lockdown with just houses. Because people are not following those rules. Those are some of the challenges that we see. And of course, we need to keep on ramping up testing. Whether we are doing the PCR-based test to detect active cases, whether we are doing the RDT test to look at how many people have actually had this thing that they need to know in the community. How are we going to obtain other testing mechanisms like the gene expert kits that we talked about at the World Health Organization? It's an evolving situation, it's a good situation. But I think one thing I just want everyone to know is we are all stakeholders. It's not a matter of the medical field is a stakeholder or somebody else is a stakeholder. Everybody is a stakeholder because all you need is for one person to have COVID, you will spread it to any other person.
Okay, Dr. Shodipo. Nigerians are actually losing faith, when it comes to these, when we are looking at these numbers daily as it's increasing. So should you say that, should Nigerians actually look somewhere else? Because, like I said, they are losing faith.
Well, the truth is that the whole trend all over the world is we are on a trajectory. And that trajectory is going to lead us. I know that people see those numbers. Initially, people saw those numbers with a lot of fear. Initially, people saw those numbers with a lot of seriousness. But now, I think some people, they just become numbers. But I keep telling people, those numbers are human beings. So when you look at those numbers, just realize that you are dealing with social number of human beings. And that is just the tip of the iceberg. Of course, you need to commend the government because the government is interesting. There are some states, for example, that give themselves a false sense of security. We don't have any kids. But what they are saying is that a lot of more people are dying. So we need all Nigerians to see those numbers as a call to action to have change their behavior.
Yes,
and
okay.
Our own call to people is that if we change that behavior, the earlier we change that behavior,
Dr. Shodipo, aside from medical stuffs, do you think Nigerians should look somewhere else?
Do you think Nigerians should what?
They should look somewhere else because they are losing faith. Apart from medical stuff, do you think they should look somewhere else?
No, the truth of the matter is, when you are dealing with a public health emergency like this, as I've explained, there's nowhere else to look to. We should only look to ourselves. If one of us were following those simple guidelines, we would not even be having those numbers. That's just the truth of the matter. And a good example that we can use is a country known as New Zealand. So I think, yes, and every other person can just Google that up. You can even look at places like South America. You can look at places like South Korea. All it took was the challenge we have in Nigeria is that we are looking for treatments. Unfortunately, with this public health emergency, what we need is more prevention. I know Nigerians have never been very good at prevention. And they say prevention is better than cure. So I tell everybody, instead of looking to somewhere else, instead of looking to maybe religion, instead of we had a situation where people are looking at traditional, there was a cure from Madagascar, there was a cure from this that distracted everybody. What I think that we can all do is that even if we all look to ourselves and follow these simple guidelines, we would be able to return back to our normal lives within the shortest possible time. And we wouldn't even have to all focus on the fact that, I must be cured. Because you have to actually get infected to get cured. So I think the point is, let us go to the strengths that an average Nigerian has. The strength that we have when we follow instructions, when our religious bodies give it to us. The strength that we have when some of our traditional leaders give it to us. The strength that we have when we all persevere and say we want to go into an action and do a specific task. Let's apply that to COVID in obeying the simple instructions. And even like in Britain, if you look at things, maybe I'll just end there. Before there was a 2-meter rule, before there was the fact that, you couldn't do this, you couldn't do that. They've seen the numbers that are dropping. They've got into their agreement. They are coming down. They've relaxed some of them. Today we're talking about the 1-meter rule. Very soon, things will get back to at least seemingly what they could be said to be normal. But we must go through that pain of obeying the instructions and not having a lot of deaths and a lot of complications from COVID.
Okay, Dr. Shodipo, lastly, before I started, I was talking about, the continuous increase confirmed COVID-19 cases in Lagos, and also the reports that the PTF said that the increasing cases now, it's now too much for the NCDC to handle. And also looking at the isolation centers that are now filled up, from your own view, from your own assessment, what alternative does Lagos have in managing COVID-19 patients?
Well, it's a tough call. We now have widespread community spread. So obviously the isolation centers couldn't take everybody, and even if you see the numbers of cases that are being reported daily, what we have said is we all need to sit down and come up with a strategy forward. We know that there was a point that the government was talking about even home-based care, and that is also an option. Why we use all measures to try to stop the further spread, because that is the major thing that we need to look at. Now, in anything we are going to do, we must sit down with the stakeholders. We must look at all the solutions together. It can't be a situation where somebody says, oh, we're going to do home-based care, and the people that are going to implement it don't even have confidence to be able to treat people with COVID at home, or the people that are even living with that person at home want that person out of the house as soon as possible. This is going to take a concerted effort, but we must look at it from two prongs. The first prong is try to stop the prevention. Try to strengthen the prevention and try to stop the spread. And of course, the second one is for those that already have COVID, how do we prioritize those that are critically ill and are likely to die from COVID so that they don't die from COVID? And those that are not ill, how do we ensure that they are also treated and in a way that they prevent further spread to the community? Of course, we're going to need the health workers because they form the frontline force to be able to either even in the issue of prevention, they're the ones that are going to have to do that. On the issue of treatment, they're the ones that are going to have to treat either at the isolation centers or at home or in the hospitals or whatever further mechanism we use. But we can't, it's not something that somebody is just going to come up with a solution. It has to be a collective solution. All stakeholders are going to need to put their heads together because what works in another country may not work in Nigeria. What may work for Kano may not be able to work for Lagos because they are dealing with different settings. And the only way we can do that, get all stakeholders on board, especially the medical community, who are critical stakeholders in solving this problem. And I think that way, I don't see it as a lost cause. I see that we're going to beat COVID. We all just need to come together. We all just need to see it as a collective task. And with that, I'm particularly hopeful that, in the nearest future, we're going to get back to where we are supposed to be. And even if COVID is there, it's not going to be a situation where people are dying from it, but we're just going to have a few cases that can still be managed and we move on. It's a seeming new way of doing things in Nigeria and our lifestyle.
Dr. Oluwajimi Shodipo, many thanks to you for having you on the show. It's been lovely having you with us. And of course, that's Dr. Oluwajimi Shodipo, that is a chairman Medical Guild, an umbrella body of medical doctors under the employment of Lagos State. He joined us via Zoom from Lagos. And of course, that's the end of the show today. If you're just joining us, you can always get more of these, and you can always go back to the beginning of the show and also watch it as he has done, analyze some of the things that we read, some of the questions that we've always had in our minds. And also, if you want to get more of the stories that we're reporting here on this show, you can always visit our website, and that's www.vanguardngr.com. And you can always subscribe to our YouTube channels and follow us on our social media platforms that are showing on your screen. And ensure to always stay safe, stay smart, protect yourself, and also protect others. It's bye from me, Damilola Obushaki, from Lunchtime Discourse on Vanguard Live.